Let us say that the pianist is delivering a great performance. And after that, he proceeds to say, hold those carbohydrates for me, dude. Hold those carbs. And so the T-Rex right here, watching the performance with his right hand onto the phone, and proceeds to grab 2 slices of bread with his left hand because he wants to follow the instructions of his favorite musician. And so the T-Rex is defecating right now, and he wants to wipe his behind, but he can't because both of his arms, his hands are preoccupied. So he calls his family with the phone saying, fam, sorry, So the mnemonic here is hold carb T-Rex pooping fam SI. And this is a mnemonic, an acronym mnemonic for interviewing patients. These are the factors that we should consider as we are interviewing patients, and I made sure to make them appropriate in order as we are interviewing patients. Okay, so H for history, O for onset, L for location, D for duration, C for characteristics, A for aggravating factor, R for relieving factor, B for before. So did you have this experience, this chief complaint before? T for treatments, R for review of system, P for past medical history, F for family medical history, A for allergies to any medications, and then M for medication list, S for smoking history, and I for illicit drug use or recreational drug use. So these are factors we want to consider to grab an overall picture of the patient history and then look into physical exam findings, diagnostic testing, and differential diagnosis. And so let's look at history. So history, we want to grab that chief complaint, all right? We want to know what's going on. O for onset. So onset is when did this occur? When did this chief complaint occur? So was it yesterday, today, this morning, this afternoon? Location. Where did this occur? Is it on your chest? Is it on your legs? Did the pain occur at your left elbow? Duration. Is this persistent? Is it intermittent? Is it waxing and waning? Characteristics. How would you describe this pain? Is it numbing? Is it aching? Is it dull? All right, aggravating factors. So what makes it worse? Does walking make it worse? Does laying down make it worse? Relieving factors. Does sleep make it feel better? Does walking make it feel better? Before. Did you have this chief complaint before? And if so, did you treat it in any way? Treatments here refers to have you tried any over-the-counter medications or anything to treat your current chief complaint right now. Review of systems. This is to check if there's any possible associated symptoms with the chief complaint. So do you have any nausea, any vomiting, any diarrhea, any sore throat, shortness of breath, chest pain, headache, abdominal pain, etc. Past medical history. So you're asking the patient if there's any chronic conditions that he or she has. So any diabetes, hypertension, any surgical history, okay? Were you admitted to any hospitals for any reason? Family medical history. So does your family have any history of cancer? Okay, if there's any diabetes history or hypertension, high cholesterol, etc. Allergies. You want to know if the patient has any allergies to medications before you're prescribing. So any allergies to penicillin, sulfa drugs. So you want to make sure that the patient may have true allergies. So if he or she are allergic to a certain medication, you want to know what's the response, okay, to check if it is a true allergy like hives or anaphylaxis. And next, we have medication list. You want to know what the patient's medications are, what he or she is on. And so this is to prevent any drug-to-drug interaction. You want to do medication reconciliation to see if there's any drug-to-drug interaction, or maybe it could be the cause of the chief complaint, actually. All right, smoking history. You want to ask if the patient is smoking any cigarettes or use any tobacco products. Illicit drug use. So you want to see if there's any drugs, illegal drugs that the patient is taking that may coincide, may have drug-to-drug interactions with the current medication list. All right. Okay, and when you're asking for a medication list, it's not only prescription medications, it's also over-the-counter medications, herbal products, etc. So these are factors to consider as you are interviewing patients. And I think that this is an appropriate order. So remember, hold, carb, T-Rex, pooping, fam, SI. I know that's a mouthful, But if you remember the storyline of how this occurs, you can remember the questions that you can ask the patients. I hope that helps. Have a nice one.